World Stroke Day 29th October 2023. Theme: Together we are hush greater than stroke. A silent brain stroke. The word stroke is related to the Greek word apoplexia, which implies being struck with a deadly blow. The causes of silent brain stroke are similar to stroke, but its symptoms are not visible, due to which it is difficult to detect and cannot be treated. Brain damage is caused due to lack of oxygen and cannot be repaired. Blood supply to a part of brain is suddenly cut off, depriving brain of oxygen and damaging brain cells. As it disrupts blood supply to a part of brain, and it doesn't control any visible functions like speaking or moving, so we might never know a stroke occurred. It is also called silent cerebrovascular accident. A silent stroke is usually diagnosed by chance, either when a person is being examined for an unrelated condition or has mobility or neurologic, brain-related problems that cannot be explained, and when they have an MRI or CT scan for another condition and doctors notice that small areas of the brain have been damaged. Imaging tests that can diagnose a silent stroke include magnetic resonance imaging (MRI), computed tomography (CT scan), transcranial Doppler ultrasound (TCD). Symptoms: silent brain stroke occurs mostly in the elderly. Therefore, even if some symptoms are seen, people ignore them considering them to be symptoms of aging. Sometimes some such signs may be seen in case of silent brain stroke. Temporary numbness or weakness in the face, arm, or leg, poor memory, breathing problem, able to balance, sudden change in mood, decreased ability to think, poor memory, urine leakage, difficulty controlling bladder. Causes: blood clots, bleeding in the brain, narrowing of the arteries in the brain, high blood pressure, high cholesterol, diabetes, heart disease, smoking, obesity, family history of stroke. Here are some of the possible long-term effects of silent stroke: cognitive decline, dementia, memory problems, difficulty in concentrating, difficulty in speaking, difficulty in walking, balance problems, depression, anxiety, etc. How to protect yourself preventing silent stroke? Control BP. Researchers' trusted source have found that high blood pressure raises risk for having silent stroke. Consult your doctor and get it treated and take precautions. Cut down on salt intake. Eat less salt. The American Association recommends that eating too much salt increases the amount of sodium in the body, due to which there can be a high possibility of high BP and risk of stroke increases. And it's not just the salt you sprinkle. Up to 70% of your sodium intake is in frozen and prepackaged foods. Manage your weight. Having a healthy weight is important for your overall health. Being overweight can cause problems like cholesterol, hypertension, and heart disease. All these increase the risk of stroke, so maintain a healthy weight. A body mass index of 18.5 to 24.9 is considered normal. Do not smoke. Smoking increases the risk of stroke. So if you smoke, stop it today. Smoking is associated with an elevated risk. There is further increase in the risk of stroke when some form of oral contraceptives are used along with smoking. There is recent evidence that long-term second-hand smoke exposure may increase the risk of stroke. Diabetes. Diabetes can cause problems like increased cholesterol, weight gain, and heart disease, which also increases the risk of stroke. So if you have diabetes, manage your sugar level and take other precautions so that it does not increase too much. Diabetes, especially when untreated, puts it at greater risk of stroke. Exercise. 2011 study showed that 30 minutes of moderate exercise 5 days a week may reduce your chances of having a silent stroke by up to 40%. If you are physically active, you'll also have fewer stroke complications. Trusted source and better outcomes than if you are sedentary. Exercising helps in managing cholesterol, weight, BP, heart diseases and diabetes, which reduces the risk of stroke. Reduce cholesterol. Bad cholesterol blocks the arteries. Because of this, the risk of stroke increases. Therefore, do not include processed food, oily food, etc. in your diet. Eat green vegetables, fruits, curd, nuts, etc. Increase good cholesterol and reduce bad cholesterol. To reduce stroke risk, your overall cholesterol level should be lower than 200 milligrams per deciliter. Your HDL, good cholesterol, should ideally be 60 milligrams per deciliter or higher. Your LDL, bad cholesterol, should be under 100 milligrams per deciliter.